Okay, everyone, it is just gone 6 o'clock, so I think we'll start. I'd like to offer you a warm welcome this evening to our Oxford BRC seminar on clinical academic careers. It's with great pleasure that I introduce 4 colleagues. Firstly, Vasiliki, who's the Chief Operating Officer of the Oxford BRC, who will introduce the seminar and do a quick introduction to us all. Then I have pleasure in welcoming Kay Mitchell, who's the Associate Director of the Southampton Academy of Research, who has also been heavily involved within the Southampton BRC, working at academic clinical career development leadership, and she's also one of the 70 at 70 nurse leaders. I'd also like to welcome Dr. Cathy Henschel, who is a clinical academic nurse. Cathy's a reader at Oxford Brookes University and Head of Research Delivery at Oxford Health, and is one of the NIHR Associate Directors of Nursing for the 70 at 70 programme. And lastly, I'd like to welcome my colleague, Dr. Louise Strickland, who is a clinical academic nurse here at the Oxford University Hospitals Foundations Trust. Louise has done her DPhil at Oxford and is currently a trainee surgical care practitioner, as well as a postdoctoral clinical academic nurse. So without further ado, I'll hand you over to Vasiliki. How we're going to work this evening's seminar is we will have all 4 speakers speaking. While they're speaking, we would like to ask you to put questions into the Q&A box. And while they're speaking, I will document all the questions so that when we finish the planned sessions, I will ask on your behalf questions to our panel. Thank you very much. So over to you, Vasiliki.
Hi, good evening, everyone. I would like to welcome you to today's event. It's my great pleasure to welcome you all. My name is Vasiliki, as Helen said, and I am the Chief Operating Officer of the Biomedical Research Centre here in Oxford. I will be calling the Biomedical Research Centre BRC for the next 3-4 minutes. There are 20 BRCs, if you like to know, in England, and we are one of them. We are one of the largest BRCs in terms of funding and in terms of activity in the country. We are currently in year 5 almost of the 3rd BRC, and I'll just very briefly introduce how the BRC started and what we are currently doing. The BRCs ran for 5 years. We received funding from the NIHR for 5 years. The NIHR, the National Institute for Health Research, which is a branch of the Department of Social Health and Social Care. We received our first funding tranche back in 2007. We had received at that time £57 million to promote translational research from the laboratory bench to the patient bedside. In 2012, 5 years after, we received almost £100 million again for the same mission and vision to promote translational research, wealth creation, and patient benefit. And in 2017, we received £113 million. As you can see, our funding goes up every 5 years. And this is basically a recognition of the outstanding contribution of our BRC to the wealth creation and the national research agenda. In our current BRC, we support 20 themes, 20 subjects, if you like, and our subjects, our themes vary from cancer and cardiovascular to vaccines, infection, immunity, and so on. You can find a lot of information about our themes, our subjects on our website. We currently have 16 research themes and 4 cross-cutting themes. With the funding that we get from the NIHR, we promote research, we support a number of researchers, mainly at the university, because the BRC is a partnership between the University of Oxford and Oxford University Hospitals, and we are based at Oxford University Hospitals, but the majority of the activity, if you like, takes place at Oxford University. As we speak, we support 700 studies, a number of clinicians, research administrators, researchers, nurses, midwives, allied health professionals, and so on. Last year, just for your information, our researchers published over 1,000 peer-reviewed publications, and they managed to attract over £200 million of external funding. So we are very active in a number of areas, including training and education, PPI, business development, commercialization, and so on. In a nutshell, that's what we are doing in our BRC. We are very keen to promote activities like the one today, and we are very keen to work with midwives, allied health professionals, and nurses going forward. Thank you, and I hope you enjoy the rest of the event.
Lovely, thank you, Vasiliki. So the way we're now going to go, we're going to have Kay Mitchell speak first, and then Cathy Henshall, and then Louise Strickland. So I will leave it to you, and then I'll pick up after Louise is finished. Many thanks. You're on mute, Kay.
Sorry. Thank you very much to the organisers for inviting me to speak this evening. I've put my timer on, so if an alarm goes off at some point, it's nothing more urgent than telling me I've whittled on for far too long. But I've been asked to talk about two things tonight: what my experiences are of developing and promoting clinical academic roles for nurses, midwives and allied health professionals, and what I think the barriers and enablers are to this. And I'm going to talk about it both from a strategic point of view, so if you were trying to encourage this within your organisation, but also for individuals who actually are thinking about pursuing a clinical academic career. And I have been involved in research full-time since about 2006, but it wasn't until 2010 that I really started getting involved in trying to build research capacity and capability. And this was whilst I was working at University College London Hospital, which also has a biomedical research centre, and the director of the BRC was getting a lot of encouragement from the chief nurse of University College Hospital to use some of the BRC money to support nurses and midwives in particular to pursue clinical academic careers. So I was asked to look at how I might be able to do that for him. And so that was how it worked. I started in London, and then I set up a similar organisation, the Southampton Academy of Research, in about 2016 after I had moved to Southampton. So the idea of both of these organisations that I set up to try and promote clinical academic careers were that they would be virtual, that they would signpost individuals to opportunities that they had to engage with research, and that it would help them develop along that career. And there were four things that I really tried to emphasise. The first of which was skill development. The second of which was promoting role models. The third bit was trying to provide individuals with specific guidance. And the fourth of it was promoting activity of nurses, midwives and allied health professionals as a whole. So, conscious that I've only got 3 minutes left. Barriers. I think some of the barriers really haven't changed over the course of the last 12 years, which doesn't mean I don't think I've made progress, but I just think that they're big barriers and they're things that you just need to keep working at to overcome. One of the key things I think is that there's a lack of a research remit in people's job descriptions and job roles. And if we want to get nurses, midwives and allied health professionals really supported to do research, then we need to make every single person make research the business of every single individual within an organisation. That doesn't mean that they have to want to do research themselves, but they have to support other people to do it and support their patients to take active roles in research. I also think that there's still a lack of role models. And if you don't have a role model, if you cannot see someone that you want to be, then why would you even think to go there? There's a lack of parity in salaries between clinicians and academics, so it's very difficult to create these joint appointment roles between trusts and universities, but I think these are key to those sorts of careers. And sometimes I think there are individuals within our own professions who are our biggest barriers, and that we need to encourage our supporters to help us overcome the barriers put up by individuals. So very quickly, because I'm conscious I'm about to run out of time, I think what has helped me to support other people to develop their career is that I've gone and found individuals who are my champions. I don't care who they are. They may be medics, they may be nurses, they may be allied health professionals, they may be research scientists. But if they have influence, then I will use them to try and support what I'm trying to do. You need to work out who your stakeholders are. This is whether you are an individual or if you're in an organisation. You need to find out who are those people who are very likely to want you to carry on doing what you want to do. You need to choose your battles. What are you going to fight, and what are you going to find a way to get around to pursue the career that you want to pursue, or to develop the organisation that you want to develop. I think you need to look for quick wins, so things that you can do very easily that will demonstrate that you've actually made a difference in what you're trying to do, whether that's in research or whether that's in getting funding for what you're trying to do. I think you need to be very clear about what you've achieved. So take care of your own metrics. And what I mean by that is, you know, look for things that demonstrate that you're making a difference. So whether that's your influence on social media, whether that's the publications that you've had, whether that's posters that you've put in, abstracts, that sort of thing. You've got to learn to promote yourself. And as an organisation, I think what one of the key things that organisations need to do to help individuals develop clinical academic careers is spend time on one-to-one conversations. I think that I don't think you can underestimate the value of working with individuals and helping them navigate the career pathway, because I think the navigation is really hard. I think it's better than it was, but I still think it's really hard. It's hard to find out what you can apply for. It's hard to find out when you should apply. It's hard to find out what's available to you. It's hard to find people to support you. And I think if you can find an individual who will sponsor you or mentor you or spend time with you, I think that's absolutely invaluable. And we both with at the Centre for Nurse and Midwife-led Research that I set up at UCLH, and the Southampton Academy of Research that I set up in Southampton, we have these drop-in sessions. We call them at Southampton scratch your itch sessions, and they are an opportunity for, if there's something that's really bugging you that you want to change, it's that research idea that you're trying to develop, then let's work with you to try and get you to do that. But I think it is so hard to actually navigate clinical academic careers that we need to give people all the help they can get. That's my 8 minutes, I'm afraid.
Lovely, thanks, Kay. Over to you, Cathy.
Okay, hi everybody. I'm Cathy Henschel, and I've been asked to speak just for a few minutes about my experience of the higher education component of my role as a clinical academic. So what goes on in the university setting, part of it essentially. So when thinking about this, I thought it'd be useful maybe to just think about some of the kind of core components of the academic side of a clinical academic career for nurses, or for anybody really, but think about how they then align with the clinical academic role and how those synergies and partnerships and things can come together. So I'm just going to run through some of the key things that kind of are the focus of the academic part of a clinical academic career. So a large part of the role in a university setting is applying for and hopefully securing grant funding. This is really important because it enables essentially you to pay your own salary, which is what universities really like to see. And it also brings in kudos and enhances reputations for universities as centres of research excellence. So it's really important to try and bring in grant funding. So thinking about the last year or so with the COVID pandemic, there's been a couple of funding awards that I've been involved in securing, which have been very much aligned with my academic role at Oxford Brookes University, but also with my NHS role as Head of Research Delivery at Oxford Health NHS Trust. So one of them is a grant from NHS England looking at exploring the spiritual care experiences of BAME health workers during the COVID-19 pandemic. And another one is a Burdett Trust for Nursing grant looking at developing an online resilience tool for nurses working during the pandemic as well. So you can see that even though these are grants that have been secured through the university, through Oxford Brookes, they're very much going to take place and be focused around healthcare staff and workers at Oxford Health, but also at other NHS trusts. So that's an example of how the grant funding can align with your clinical environment and setting. Another key part of the role is providing supervision at all levels, but especially for PhD students. And again, this can really align with the clinical academic part. So one of my PhD students at the moment is involved, she's just started and she's involved in developing a research readiness tool for nurses working in the clinical setting to try and find out what are the enablers, what environmental factors can be put in place to help support clinical nurses to be more engaged and to carry out more research active kind of roles and responsibilities. And that will take place across Oxford Health, but also Oxford University Hospital Trust as well. So again, the partnership between the different settings aligns. A really important thing in an academic setting, as Kay mentioned, is to really publish and get your research out there in peer-reviewed academic journals, nursing and otherwise, healthcare journals. And a couple of recent publications in the last few months I've published. One actually is about clinical academic pathway development for nurses in the United Kingdom. And the other one was reporting on a opt-out approach that we implemented at Oxford Health, which is all about making it easier for patients or service users to be given the opportunity to decide whether they want to take part in research. So again, that synergy is there. So it's really important to try and keep publishing as much as you can. Other parts of the role include developing seminars and workshops and providing supportive training initiatives and things. And one of the things that we do as a collaboration between the university and the trust is to run biannual writing retreats, academic writing retreats for nurses to encourage nurses to publish, and they're open to AHPs as well, to publish and to get mentorship support and guidance so that you, within a 3-day period, you can then have a kind of final or near final draft for submission. So things like that are quite good developmental opportunities for other people and promote engagement across the organisations. It's a really good opportunity being an academic in a clinical academic role to really utilise that to build links and networks through the trusts and through the BRCs in the region and other kind of pan-Oxford or pan whichever region you're in, links and networks, because you can utilise these networks then to inform your research and pull people into funding grants, pull people into research teams, or just get really good feedback and ideas about what are the clinical issues that really matter and what are the things that we really, really need to explore. And that's a really good opportunity that isn't open to a lot of people who are purely academic. It helps me personally to be working as in a senior research delivery role to understand what are the issues and barriers on the ground, what are the challenges that research nurses are facing all the time, and use that to think about, okay, so what are the issues and what do we need to work on? And that then informs my research ideas and thinking. So it gives you a bit of a grounding in the clinical space. And as I said, another key part is that academically I can support people in the HEI, the university institution, but also my clinical colleagues in the trust to help develop their academic skills, their research, nursing research skills as well. So it works both ways. In terms of some of the enablers and barriers to the role from a higher education university perspective, I think just some considerations are that it's really important in a clinical academic role to try and make sure over time that your role in the university aligns quite well with your role in the health care setting, in the NHS setting. So that might seem obvious, but for example, from my point of view, I've been in my role for a few years now, but when I came into the role at Oxford Health, it's a community health and mental health trust, but my clinical focus and research focus to that point was oncology. So whilst I still carry out and have a focus on cancer research, oncology research, over the years I've developed more of a research focus as well in areas such as mental health, but also nursing workforce development and those sorts of things. And that's really been a strength because it's allowed me, as I talked about, to really draw on my networks and links in the trust to really enrich my research. So if you can get alignment between the two, it makes the whole thing a lot easier. You might want to consider who your substantive or main employee is going to be. There's pros and cons to having your main role in an NHS or a university setting, and catches with both, but there's something called the Research Excellence Framework, which is really important to universities. And so if that's important to you as well for your future career, then it's probably best to be based in a university setting. But there's definitely pros and cons to both things depending on what you want to get out of the role. It's important, which is kind of a bit bigger than the individual clinical academic, but if the two partner organisations can really align and are really committed to clinical academic roles, that's really important, and have a shared vision and shared commitment, including financially as well, that they're going to commit to the role over a long period of time in order to grow and see change. It's important that line management support is as joined up as it can be. So for me, I have a line manager in an academic and my clinical setting, but there will be other clinical academics and line managers that talk to each other more or less, and that can impact on the shared vision and the joined up working. You can be quite a trendsetter, or you can be quite autonomous, because there aren't very many clinical academic nurses in a lot of NHS organisations. That's good and bad. It's good because you've got a degree of autonomy and freedom, but it's also bad because you don't have that role modelling that actually, and you can't see other pathways and think, okay, how do I get there? I need to follow them. There's not always anyone to follow. I talked about research projects aligning with the needs of the trust. That's great if you can do that. And I also talked about kind of the need, the great thing about it is increasing those collaborations between the university and the NHS setting. So I'm going to stop there because I think that's my turn up. But those are just some of my kind of thoughts about it from the academic point of view.
Lovely, thank you, Cathy. Over to you, Louise.
Hi, thanks very much, Dr. Walthall. And I'm really pleased to be here tonight and glad to see so many people and so many familiar names that I've been working with clinically over the last few months. So I'm Louise Strickland. I'm the clinical academic nurse researcher at OUH Trust and at the University of Oxford. And I was asked to just chat a little bit about my experiences of this role at the Trust in combination with the clinical academic side and the practice side. And then also a little bit about what my thoughts are on the enablers and barriers to this role and making it work from the clinical side of things. Some of the things that I'll mention have been touched on by other people, but I think it's difficult to talk about one without mentioning the other because they're so intertwined by the nature of the position. So my role is 50% research and 50% clinical. My research side is based at the Trust and in combination with the University of Oxford, where I also did my DPhil in the Nuffield Department of Orthopaedics, Rheumatology, Musculoskeletal Sciences, called NDORMS for short, which is much easier to get your mouth around. And then clinically, I have a role as a trainee surgical care practitioner within the spinal surgery team. And so that is an advanced nursing role, but other specialties do apply to become SCPs, surgical care practitioners, mostly involved in the surgery side of things, but you see patients through the entire sort of patient care continuum when they first present to clinic. Sometimes you meet them when they present to the emergency room, or, you know, their GP may call with a problem, and then you see them right through ordering imaging, preparing them for surgery, informed consent, assisting as they go off to sleep, through the surgery, and then through their hospitalization, discharge, and you really become a real point of contact for those patients. And as it is an advanced role, it ties in really nicely with the academic side of things because you're able to look at things from a different perspective, because you're there the whole time. And that was one of the things when I went in to do some more research and I got my degree, I really wanted to make sure that stayed connected to that clinical side of things, because that's reminds you why you're doing what you're doing, and all those questions come up that we know about in our daily practice that we want to answer. I think for me, it's been a really interesting few months. I only started 2 months ago. And I'm also doing the training program just now through the Royal College of Surgeons for that part of things. So some sort of challenges in terms of time management. You know, you want to give yourself 100% to the new role, and I'm having to find a balance with that. But I've got some great mentors on the research side, which people have mentioned is so important, and also on the clinical side. And so we're working through to find that balance and see where the role goes, which is really exciting. In terms of challenges to the clinical academic, because I'm conscious of my time and I'm halfway there already, there's sort of 3 broad areas I think that are challenging for nurses, midwives, and all allied health. And that would be funding opportunities, which have already been touched on, infrastructure and pathway. You know, there's quite a clearly defined path for medics, surgeons, scientists, as they want to progress in clinical academic careers. But I can't tell you how many times I got asked the question, what does a nurse want a PhD for? And I said the same reason anyone else does, because they're interested in research and they want to, you know, make a difference with patient care. And then again, the support and mentorship that has been touched on by our 2 previous speakers. You know, who do we role model to? How do we navigate this, and how do we find the support that we need? I was really fortunate that earlier in my career, before I started, I had an opportunity to do an nursing an allied health internship program, OXMINT, that was started by some research nurses and the director of graduate studies at the Botner, which is over beside the Nuffield Orthopaedic. That's a research building for endorms. And it was a 6-month part-time program where I was able to do a bit of both. And that really opened the doors for me, because I had a consultant surgeon who said, you've always said you were interested in research. And that was the pathway in. From my personal perspective, the BRC has been great. They're so supportive, and the door's always open. There's people you can email and say, I'm thinking about doing this, what should I do? A lot of work is being done just now, as Dr. Henschel mentioned. She and Dr. Walthall did a publication recently about clinical academic pathways, and that's something that a lot of people are looking at. There's new NIHR incubators, which are specifically focusing on that too. There's a nursing incubator and advancing surgical technology, because I'm more based in the surgery side of things. And they're really looking at how can we enable opportunities for nursing and allied health professionals, because it is a lot, it's a lot more challenging. It's not as available to us in our undergraduate programs, and a lot of the time we're right into the job in the workplace, and we don't have that time to do research that a lot of other medics and scientists perhaps do. So it's a really exciting time just now to be in research and clinically at the same time. And I think there's a lot of opportunities now opening up. And for example, with Dr. Walthall's position for the Trust too, and Dr. Henschel at Oxford Health, it's really given us an opportunity that we previously didn't have to see what we can do. Yeah, so really glad to be here. That was just a little bit of an introduction. Thanks.
Lovely, thank you. I'm just going to start with some questions that have already come through. And the first one really is probably to, well, I don't know who it's to. I'll put the question out there and one of you 3 can say who wants to answer it, because it is a very generic question. So the question is, I am interested in a NIHR CDRF. How do I do that? Do you think, Kay, that might be you? I think it might be you, Kay. How would someone go about applying for a CDRF?
So, well, first of all, they've just announced it's changing slightly. So we were expecting the launch of the program to be in the next month, few weeks, but in fact, I think it's going to be delayed slightly because they're combining it with the doctoral research fellowship program. That's the word on the street. I would strongly suggest that if you're thinking about applying for a CDRF and you're just starting with it now, that you probably wouldn't necessarily think about applying this year, but you might think about applying next year, because these applications are massive and you need to get a good team around you to actually help you with that sort of an application. But I would first of all go probably to the BRC or to Cathy or to Helen and find out who they would recommend that you speak to. I don't know the Oxford situation, but if it was someone in Southampton where I'm based, I would get them to come and speak to me, and I would sit down with them and go through why they want to do it, what their research interest is, and then start signposting them to individuals that can help them put their application together. The reason that I say I probably wouldn't encourage someone to go this year, as I said, is because they're really big applications and you need to get you only get so many bites at the cherry. So if you put an application in and you're rejected, then you only have one more chance to put that application in before you then can't apply for that sort of funding. So it's actually really worth making sure that you get a good application together. And we in Southampton run workshops well before we know that the funding call is going to open, because we expect people to be quite well developed in their applications before the funding call even opens.
Lovely, thank you. Can I just say someone's asked what CDRF stands for?
Oh, it's a Clinical Doctoral Research Fellowship. And I'm presuming that this individual is talking about the one that the NIHR fund, but there are clinical doctoral research fellowships that are offered by other organisations as well, and certainly some local organisations have their own form of it. But it's basically funding that usually buys you out full-time to carry out a PhD, and the clinical aspect of it means that there's a portion of time is for you to develop yourself as a clinician as well. So they would expect you to put in an application that showed how you were going to develop as a researcher, but also as a clinician in the role that you were choosing to do.
Just to add very quickly to what Kay said as well about giving yourself enough time to really work up a strong application, it is really, really important. But things that you can do on top of your application to strengthen it are things like trying to, I don't know, do some work with it or make some links with some established research teams in your area. Try and see if you can get on board as a co-author on a publication by contributing to the data collection or something in some way, or try and do some pilot work with PP or PPIE work, patient public involvement and engagement work, to kind of get some background on your study, or try to kind of present something about it. You know, just do things which show that you're committed and that you've done your homework and that you're really kind of wanting to build some expertise in the area. And that those will be things that the NIHR and other funders will really look at and think, okay, that stands out from other applications. So those are the sorts of things that if you've got time, you can work towards, as well as developing your application.
Lovely, and one of the participants has suggested to also speak to the Research Design Service, which is in every region, which is an NIHR funded facility. So please do connect with those.
And in fact, Helen, the RDS run workshops themselves on how to apply for this sort of thing. So you can actually ask them and they'll give you tips.
Lovely, thank you. One question which has been a bit of a theme across is how do we get NHS organisations to buy into research time and research development for NMAHP? And Cathy, I guess because you're in a strategic role within a trust, would you like to speak for that, please?
Yeah, I mean, I think it's really difficult. It's really challenging. Like I said before, this isn't a clear-cut pathway for nurses and NMAHPs, and you know, like it is for are more established pathways for our medical colleagues. It's difficult. There is a lack of role modelling. NHS trusts might not have, I mean, some trusts in the country are brilliant and have got really well developed NMAHP pathways, and they've got a structure and infrastructure and a model in place, and that's great. But for lesser established trusts in that respect, it is difficult. On top of that, there's the age-old but very relevant, especially at the moment, pressures of time, and protected time for research is still seen, unfortunately, as a bit of a luxury and something that other people do, despite the fact that really, as nurses, we all know that all of our practice should be grounded in the evidence, and that we can't move forward and provide the highest quality care unless we've got that evidence base. But despite that, it persists that it's not really something that's a core part of roles. So I think there's lots of things that we can do to change that, to try and change it, but it is a long kind of change process. We have to be prepared to put in the long haul. I think there's things like making sure that research is embedded within nurses and AHPs job descriptions, and that it's actually reviewed rather than just being in a job description and then staying in a job description in the cupboard. It needs to actually be reviewed by line managers and by supervisors to make sure, so that people are held to account a bit and asked, well, how are you engaging in research as part of your role, whether that's as a clinical academic or actually in other senior nursing clinical posts within trusts. I think there's something about setting kind of outcomes to think about, well, what's this going to bring back to the clinical area? How are you as an individual going to be able to move things forward and engage with practice more as a result of the research? I think, as I kind of alluded to in my little 8 minutes, I think there is something about having a shared vision and coming on board with the university and the NHS institution and thinking about what's the shared vision and what added value is the role going to bring to both organisations, and what synergies are going to come from that, and having a clear strategy over a number of years. And also, I think NHS organisations need to know that it's not going to be an overnight change, but it's an investment in time and in people, and that, you know, it might take 5-10 years to actually see these positive changes, but if people invest, then it's worth it. And I think on that note, Helen and myself, in partnership with colleagues across Oxford, are in the process of developing a clinical academic pathway pipeline, if you like, for nurses and allied health professionals across Oxford, to try and break down some of those barriers that do make it really difficult for nurses to get a foot in the door, and provide support, resources, training, advice, mentorship, supervision, all those things from a kind of junior or kind of pre-reg level all the way through to doctoral and postdoctoral level qualifications, to try and make that resource or lack of kind of support a bit more structured across Oxford. And we're looking at models at other places in the country where they've done that really successfully. So I don't know if that's answered the question. I think it's complicated and difficult, and there are lots and lots of challenges, but I think it's about time and commitment and that shared kind of buy-in from both organisations.
Lovely, thank you. And there has been quite a few, there's a couple of student nurse colleagues on the call tonight, and a number of them are asking how, as a student, they can get involved in research early to get them into being ready for a clinical academic career. Louise, would you like to answer how you got into that?
Yeah, I think it can be really challenging because, you know, having spoken to quite a lot of students when I've been in clinical placement and actually in research too, they don't always have the opportunity to be involved in research at that point. So I think when you're in your placements, if you hear about studies that are happening, or quite often there'll be flyers that are put around by the research nurses asking, you know, is there someone I can shadow? Is there any way I could, you know, follow through a patient? It's a real challenge. I know that in Oxford, over at the Nuffield Orthopaedic, one of the head research nurses there, Gail Lang, she really felt quite strongly about this, because a lot of students were coming through, they were getting some placements, they were interested in research and didn't have the ability. So she worked closely with several of the orthopaedic research funding bodies, and they came up with internship programs. And she also takes pre-reg students, and they have a 6-week research option that they can do. which was something completely new, and they get exposure. And when I first started doing research, I felt like my eyes had been opened up. You know, I'd seen envelopes in theatre because I've worked in operating theatres for a long time, you know, and you would randomise the patient with the envelope to get one drug or get another or something like that. But I'd never seen the whole sort of mechanic of research. And then when I had this opportunity to see it, it really opened my eyes, and I knew that in addition to still maintaining some clinical, because I love surgery and that side of things, that it was something I wanted to do. So asking questions and just seeing who's doing the things around about you. Maybe get involved through the BRC if they have a PPI, which is the public and patient involvement. Sometimes that can be a way in, because they'll have seminars for people that are interested in research too. Again, tying back into the BRC, because there's just so many different opportunities, I think, that you can get your foot in or find out a little bit more. Maybe if you're in outpatient clinics, it's really just keeping your eyes open, doing a bit of research around where you're working, and a bit of luck too, you know, that you come across the right person at the right time. But definitely, if you have an interest, you know, do a bit of research. Google is great, social media is great. I've connected with so many researchers here in Oxford and around the world through social media. If there are, when we get back to the days where we'll have meetings in person, you know, that's how Cathy, Henschel and I first met, was at a research and multidisciplinary sort of education event run by Dr. Westcott, who's from Brookes. And you meet different people in that, and they can help you on your path. But it can be frustrating, and I really appreciate when you're clinical and you're trying to study at the same time. It's really difficult to find that time, but keep the faith and keep asking questions, and you know, keep your eyes open.
Lovely.
I would say, sorry, just to add as well, I would say as well, if there's a clinical academic nurse in your organisation or another clinical academic, that AHP academic, then don't be afraid to go to them and ask them just for any opportunities that might arise, because no matter how big or small they are, if it can give you some experience. So, for example, we've got clinicians in our trust who have got involved in supporting systematic reviews that are going on at the university. So that's a really good way that they can then get the experience of a review, but also get the name on a publication. We've got student nurses at the university that have come on board in the trust and have had not work experience, but actually supported the delivery of some of the COVID-19 trials over the last year. So they've got first-hand experience of the actual research delivery side of things. So it can work both ways, but it's about seeking out those opportunities. And even if there's nothing on the day, if you're keen and enthusiastic, then whoever you go to, I'm sure will make a note of it and let you know when other opportunities do arise.
Lovely, thank you. We've got quite a few questions from AHP colleagues, so particularly from physio, OT, paramedics, who are feeling that there is a less of a clear pathway for them than there is nurses, and there is less opportunity both within clinical practice and post-doc. I'm wondering, Kay, have you had any view from that from the NIHR's point of view?
It's interesting because if you look at the number of, if you look at the metrics of nurses and midwives applying for funding and being successful compared to allied health professionals tend to be much more successful. That's because they have been, the qualifications have been at degree level for a much longer period of time, I suspect, but also there's just been that much more emphasis on kind of a more academic type of training. So although the absolute numbers of AHPs who are successful in getting clinical academic support is much smaller, that as a percentage of the total numbers of AHPs, there are many more AHPs who are in clinical academic roles. I would say that if you're wanting to get investment, if you're wanting to find support for developing as a clinical academic, as an AHP, I would go for one of my first ports of call would be to go onto the NIHR website and type in NIHR advocates. And these are clinical academic leads within all of the different AHPs, as well as nurses and midwives from around the country who have been appointed to support people who want to get involved in research. So I know that one of our professors of physiotherapy at Southampton is an NIHR advocate, and she does, her name's Lisa Roberts, and she also sits on the PCAF panel, which is the Pre-Clinical Academic Fellowship scheme panel, and she's very active in trying to promote people to take hold of opportunities. Where I think AHPs can struggle though, and I think it's much harder for them in this respect than it is for nurses and or midwives, is where they're trying to get themselves released out of their day job. So what we talk about is backfilling. And with some of these funding schemes, you can get money for 1 or 2 days a week to do research, and the money basically pays for the organization to employ someone else to do your job whilst you're doing research. And the problem is that if you are the only physiotherapist who has got expertise in musculoskeletal back pain, then they are really going to struggle to backfill you. Whereas if you're a ITU nurse like I am, then they're much more likely to be able to find someone who's going to be able to take your place. So I don't think it's straightforward for AHPs, but there tend to be more clinical academic AHPs than nurses and midwives per total numbers of that profession, if I make sense.
Yes, lovely, thank you. And one question that has been a bit of a theme is, do people, both Cathy and Louise are in posts that are clinical academic posts. Was that opportune? Were posts made for you, or how did you come about having your posts? So Cathy, do you want to go first?
Sure. No, my post wasn't made for me. As I mean, I've been in the post for 4.5 years now, and over time the role has evolved and developed in line with sort of some of my areas of interest and kind of expertise and things. But the post wasn't made for me. I was in Birmingham before that, having been in a purely clinical roles in the past. I then spent a number of years in purely academic roles. So by and large, I'd either been clinical or academic, and I hadn't ever been able to find a role that was a clinical academic role. So when I saw this role advertised, even though it wasn't in cancer, which was my clinical and research area of kind of interest, because it was a clinical academic role and did enable me to work across the university and a trust setting, it really appealed to me. And I thought, okay, this is worth taking a bit of a deviation away from oncology and also moving cities for. So I think that sort of illustrates that, certainly at 4.5 years ago, but probably now too, how few and far between the right sorts of clinical academic nursing roles can be at the right level, depending on your career stage. So yeah, it wasn't made for me. The beauty of the role is that I'm really well supported in the trust to be able to shape the role and make it my own. So it feels like it's my own role now completely. But yeah, it wasn't at the outset. And yeah, it's just about looking for the right opportunities as they come through. But I did have to scour nationally to find that opportunity.
Lovely, thank you, Cathy. Louise?
Yeah, this was sort of a dream post for me. I've had an advanced role in theatre before as a surgical assistant, and this was sort of a next step that I had been interested in taking for a long time anyway. And then in addition to having finished my PhD and a 1-year postdoc, the sort of stars aligned, and this opportunity came along with support from both clinical and the research side of things. So yeah, it was just a sort of perfect combination for me to go for. Yeah.
There's been quite a few colleagues on the call who are advanced clinical practitioners, and obviously, as we know, they have a research pillar within their job plans, and they're wondering how they can get involved in research within their roles rather than doing a separate clinical academic role. as I'm just wondering whether, Kay, have you had any experience of this?
Yeah, I mean, we have quite a number of ACPs and ACCPs and PAs and things like that who are trying to develop, trying to get involved with research. I think it's just a question of sitting down with them and finding a project for them. So I think it is perfectly possible to do it as part of the current role, but you need to find that person who's going to support you to do it. And that might, and part of the problem I think often is actually identifying that research question, because particularly if you're not that, if you're quite new to research, it can be quite hard to frame a research question. So it may be that you need to find someone who's working in an area that is of interest to you and see if they can help you frame that question that you want to ask, and then support you to try and answer it. It's not easy, but it is. We've certainly got people that we're supporting to develop that research part of that job, and I think it's really important that we try to do that so that it continues to maintain that in those job pathways. Because as I was saying when I spoke originally, very few jobs have research as part of their role, and the more we can get that and preserve it and encourage it, the more we will get people to be able to do research every day.
Thanks, Kate. There's been quite a few questions about people wondering how as a newly qualified nurse or a third-year student or a AHP that you're interested, how do you take that first step to start your research journey? What opportunities do you actually need to take? We've talked about seeking out, we've talked about Googling, but if you're sitting in your clinical practice and wanting to do this, who do people go to? Louise, do you want to pick up?
Yeah, I think that's a good question, and it's a place where I've sort of found myself before too. I think if you've got someone like yourself, Helen, that's in the trust, that would be a great person to talk to. You know, if you're lucky enough to be a trust that has a director of nursing research. If not, maybe one of the education leads. I know in our division in NotScan, we've got a terrific educator, Carol Ford Johnson, and she helps a lot of newly qualified nurses and nurses of all levels throughout the trust, from senior right through to the healthcare associates and other more entry level positions that are interested, and she can oftentimes direct you. I think just speaking with other people. The RCN has a research society sometimes, or if you're in a specialist area like diabetes or critical care, looking on social media, sometimes they'll have connections, local connections that you can get in touch with as well. Yeah, educator, maybe your mentor or your preceptor, if you're in the clinical area, or other people as they're coming through. If you hear, oh, they're working on this research study, then maybe just say, oh, okay, great, could I find out more about that?
And also, just to add to that, obviously, if you're in an area where you do have a biomedical research centre, and we have 2 in Oxford, then you could also go to the training and development lead, which every BRC will have, and they will be able to signpost you towards relevant training and development opportunities for nursing and AHP research, like specific and bespoke, but also more broadly what's going on in the area. So that's a good place to start as well.
I was just thinking too, Helen, in some of the areas like in ITU, some of the nurses have started a journal club. So that's another way sometimes, and that can put you in contact with other people that are interested in learning and research and evidence-based practice too.
Lovely, thank you. And we've had some questions from colleagues who want to know, is there any sort of research opportunities for non-registered staff? So whether it's healthcare practitioners, TAs, therapy assistants. Cathy, in your role, have you developed any roles for non-registered?
There's certainly opportunities for non-registered staff. So in my role at Oxford Health, we've got a lot of clinical research practitioners or band 4 clinicians who obviously haven't got their registration or qualification, but there's still plenty of opportunities for them to get involved in, as I said, either supporting clinical research delivery or working on systematic reviews or linking with some of our BRC projects and supporting those by doing some data collection or supporting with reviewing literature and those sorts of things. So absolutely, the clinical academic pathway obviously isn't as structured, but there's definitely lots of support and things that we can offer to provide everybody with the experience that they want. And in fact, we actively encourage that everybody, that because we are so well placed in Oxford, we've got this amazing pool of resources and infrastructure and partnerships. We on all of our job descriptions and applications, we kind of try and get the message across that whilst you might be employed in a research delivery role, we really fully encourage and recognise that hopefully people want to develop in an academic way as well as a clinical way, and that we're there to support, signpost people towards both Oxford University resources, but Oxford Brookes resources, as well as the 2 BRCs, and as well as kind of our own in-house things that we've created, kind of bespoke things. So yeah, there's loads and loads of opportunities for people at all different levels across bands and range. Yeah.
Lovely, thank you. And I think we've probably got time for one more question. There's been a few people that have asked about how you are able to really combine the two, because obviously clinical has a 100% expectation of time and research has a 100% expectation of time. And how do people manage to make the job a workable job? Louise, do you want to go first, and then Cathy, and then Kay?
I'll be brief. I think taking a deep breath in the morning and prioritizing, right, okay, I've got my research head on today, and trying to focus on what's the priority for that at that point. And then by the same token, when I'm in a clinical, I mean, I can have thoughts about the other two during the day, but trying to keep my head in separate mode depending on the day. And also having really good mentors and supervisors in both areas that understand the nature of the role, because it is an unusual thing for a sort of role for a lot of people. So that makes a big difference too. And trying to have a schedule that you work through, and time management is critical.
Very quickly, I would say it's a good question. I'd say it's challenging. It's really challenging. But I don't think you should go into a clinical academic role personally if you want a quiet life, because it is really busy. It's a brilliant job. It's really, really rewarding, but you need to be prepared to work really hard and have excellent time management, but also be really flexible, be able to multitask, and be able to, when necessary, switch from your head from something to another and back to another, and be able to think on your feet and reprioritize on a daily and sometimes hourly or 10-minute basis, because things change. And often from an academic perspective, that those can be the things that drive forward your career, but actually the clinical priorities are the things that always take priority day to day. So there's always a tension between what you feel you ought to be doing and what you need to do. And it can be difficult to keep that balance. But it's good, it's worth it, but it is busy and tricky sometimes.
Okay.
Yeah, no, I think having really good ideas of what you're trying to achieve in each part of your role, and knowing, so I have 5 different jobs, and so it's about knowing what your priorities are in each of those. I'm a huge user of lists, which is the whole time management thing, and I think you also need to be kind to yourself, because not everything has to be perfect, it just has to be good enough, and you have to remember that. Otherwise you'll drive yourself mad. And it's about also working out what are those opportunities that you want to say yes to, and what are those things that you have to say no to, and trying to work out which are the golden nuggets. I'm not very good at saying no. Fear of missing out.
Lovely, thank you. We've unfortunately come to the end of our time. I'd just like to take this opportunity to thank Kay, Cathy and Louise for their time this evening, for Vasiliki hosting, and for Kelly and Roy for helping the development of the seminar. So, but I'd also really like to thank everyone for making time to attend this evening and to have a great conversation. Thank you very much.